Hi again, I'm Imanuel, and I wanted to tell you what I've learned in week 3 of the Transform Fundamentals program. This was an exciting week because do you remember when I went and got the blood work done and I said I was excited for those results to get to analyze what was going on with me with Dr. Maggie? Well, this was the week that we started to get to take a look at some of those first results. So what did we look at this week? We looked at vitamin D, we looked at ferritin or iron, and we looked at B12. Okay, have you had those levels tested before? Maybe you haven't, but maybe you have. And if so, maybe you looked at the reference range and a doctor told you, hey, your levels look good. That's what's happened to me in the past. What I learned this week in the program is that those are not the levels you should be trusting. That's the reference range, but that's not the functional level that should be achieved if you want optimal health and you want to turn around mystery symptoms or autoimmunity. So with vitamin D, I learned my level is actually low. It would have looked good again on that reference range, but it is actually low from a functional level standpoint. So I know exactly what I need to do now based on the information that was given during this week for how to supplement to bring that level up to an appropriate amount. I look forward to confirming that next week on the Medical Mastermind call with Dr. Maggie. Okay, ferritin. What did I learn about my ferritin? It's also low. Again, it would have looked normal based on the reference range values, but it is not optimal. And so I believe I know exactly what I need to do from a supplemental standpoint as well to increase my ferritin level to an appropriate value. And again, I'm going to confirm that with Dr. Maggie. B12, this one I think is maybe the trickiest one because it definitely looks like it's in the correct range. It even looks like it's in the functional level range. But here's the kicker. Dr. Maggie teaches us there is yet another lab value that you need to look at to determine if your B12 is actually good or if it's low. And guess what? Mine's low. So everything was actually low despite looking normal. So this is really good news because it means that I have room to grow. I have something that I can work on to try to turn my health around, feel better. So I cannot wait to have Dr. Maggie go over my results with me and confirm what I believe to be true for my path moving forward with these. And I really think it could be the start of me turning around some of my health issues. Have you ever had your levels tested before? Well, make sure that you're not just working with a doctor who talks to you about reference ranges. You really need an expert who understands what is the true value for where you should be to have optimal health.